There are 7 major components of this plan, including education, wellness monitors and checks, hand washing, face coverings, social distancing, cleaning protocol, and diagnosis and exposure protocols. It's important that we all know and understand that staying safe will require all of us. We will continue our efforts to educate all students, staff, and families in preventative efforts that can help minimize the spread of illness. This will include training at the start of the year, as well as videos, signs, and announcements. Our teachers will not be expected to perform all health and safety functions, and in many cases, additional staff will be provided. All students and staff will undergo no-contact temperature checks daily prior to entering the campus. Designated wellness monitors will assist in this effort at each campus. The number of wellness monitors will vary based on several factors, including the number of students enrolled in face-to-face enrollment and staff size. All visitors will be temperature checked upon entry, and anyone who may pose a risk to others will not be allowed access to the campus. Prevention efforts will also include strict hand-washing protocols. All students will be trained and supervised in proper hand washing, and staff, students, and visitors will be expected to routinely wash hands for 20 seconds. Hand washing will be required after all common contacts, such as being in a common area or after touching door handles, and hand sanitizer will be available for use in the event soap is not available. Face covers will be required for all staff, students, and visitors. However, there may be exceptions for those who are medically or developmentally unable to wear them. Face coverings must always be worn in public areas and classrooms, except for limited occasions that will be identified. The district will provide face covers, but students and staff are encouraged to provide their own for personal comfort. There will be training on proper wear, care, and cleaning of face covers. Social distancing will be in place throughout all buildings and facilities, with a minimum distance of 6 feet required in all common areas and classroom spaces. The number of students in each classroom will vary based on the size of the classroom and the ability for each student to have a buffer of at least 45 square feet around them. To help control traffic flow, designated building entrances will be implemented. Congregating in the hallways or common areas will be prohibited, and measures will be taken to reduce surface contact in common areas, such as closing off of the water fountains. Face-to-face staff meetings will be limited, and teachers who are providing instruction online or those who are at risk will be provided contact-free entrance into the buildings and workspaces. When possible, classroom and other doors are to be opened by assigned staff to limit contact. Cleaning protocols will also be in place. This includes continuous cleaning throughout the day, with emphasis on high-exposure areas such as workrooms and restrooms, as well as high-touch surfaces such as doorknobs and handrails. When necessary, appropriate cleaning supplies will be provided throughout all buildings for immediate spot cleaning by staff and students. All disinfectants to be used and provided are rated as effective against COVID-19. Outdoor play structures will be closed until further notice, and playground coordinators will promote recess activities that avoid the use of play structures. If there is a confirmed or suspected case of illness, classrooms or buildings may be closed for cleaning and disinfection. Each campus will have a COVID response team made up of trained staff members who will assist in contact tracing. It's important for everyone to know that the district will follow CDC, TEA, and county guidelines for reporting diagnosed and suspected cases, including protocols to notify parents and the school community. Self-quarantine is required for those who have had close contact with someone who has tested positive or are exhibiting symptoms for COVID-19. Anyone who is sick or experiencing symptoms should stay home.